Hi there, my name is Lauren Leonard. I'm now 28 years old and I'm a survivor of stage 4 non-Hodgkin lymphoma. I had non-Hodgkin lymphoma when I was 22, so I'm about 5 years out of treatment. I currently work as a registered nurse on the oncology unit at the Children's Hospital of Philadelphia. I've been there for about a year and I'm finishing my master's degree right now at the University of Pennsylvania as well. So I took a portion, about a third of my classes during my second degree Bachelor's of Science in Nursing, and now I'm finishing the last 3/4 of the program to become a pediatric acute care oncology nurse practitioner. University of Pennsylvania is one of 2 institutions in the country that actually offers this oncology nurse practitioner program. It's a really small program. Every year they only admit about 4 to 6 students. And fortunately, when I applied for the second degree BSN, I was admitted as well for the master's program. And my ultimate goal is to work as a nurse practitioner in cancer survivorship. I really want to work with patients who are transitioning or who have transitioned from care with their oncologist to a survivorship clinic. I know from my personal experience with lymphoma, and I know from the patients that I see every day at work, that there's so many side effects of these treatments that aren't just short term, they're very frequently long term. And unless we have people who are really trained at looking at what to do and what to find in the long term, a lot of things can get missed and people can suffer later in life. With the rates of cancer cure, especially in young children and young adults, going up so significantly in years, we're seeing such an uptick in survivors. And I think what we really need is people who are specialized in understanding what it's like to go through the treatment, what the side effects are short term, what the side effects are long term, and how to really care for these patients. Something that I'm really passionate about is fertility preservation. I felt very fortunate during my treatment to have an oncologist that made it a priority that I saw a reproductive endocrinologist. And although I wasn't capable of making a choice that allowed me to protect my fertility due to the urgency of my disease, I felt really well informed. I felt like I had the opportunity to understand what might happen to my fertility, to possibly grieve over it, to really work through it, and now in survivorship, think about what it means for me, what I should be doing to think about when I do want to try to have children and what that'll be like. I see in my job at work that with some families, when they ask for this, when they advocate for this, they get to have that conversation. But I think a lot of the time it's missed. And we either have families that the child isn't at risk of really having long-term effects to their fertility later on, and the family is so just knows that the patient had cancer or had chemotherapy or radiation, wherever it may be, and what they see on the internet, what they've heard from other people, is that they're going to be infertile, and they believe that. And on the other spectrum, we see people who are really hopeful and really think that they're going to have children one day, and the number of treatments and the effects of their treatments make that really unlikely. I think on both sides of the spectrum, we need to be having conversations with families earlier on and throughout their treatment that just give them more of the facts, that give them the opportunity to feel empowered in the decisions they make, or to handle the emotions and everything that comes with the possibility of being infertile or not being infertile, what it means for them, for their child, long term, short term. We see patients at the hospital who range from newborns who come straight from the ICU or the NICU after delivery with cancer, to patients who are 28 years old and they're still being seen in our hospital because of what their disease is and are really close to wanting to start a family. We also have patients who already have children themselves, and they need to think about, is that the only one they're going to have? Is there a possibility for them after this to have more? So from what I've seen in my job, from what I've experienced personally, I feel like there's really a need to talk about fertility, to talk with families about fertility preservation, and then in survivorship to continue to have those conversations with families, with patients, with young adults, and help them make the decisions that will empower them to live the best possible life that they can in survivorship. So I plan to continue to work on my degree part-time while I am in school full-time. I'll finish my master's in August of 2022, and I'm hopeful that I'll be able to start working as a oncology nurse practitioner, and somewhere along the line get to really work on these things of survivorship and oncology fertility that I'm passionate about. So thank you for considering me for another scholarship. I was really fortunate to have been a 2019 scholar while I was in my Bachelor of Science of Nursing, and I hope that I'll be able to be a Cancer for College scholar again in 2021.